Objectives. Behavior change skills, person-centered communication for healthcare professionals. Person-centered communication is a critical skill for healthcare professionals who want to support their patients in making positive behavior changes. This presentation will cover the key elements of person-centered communication, provide examples of how to apply these skills in practice, and discuss how person-centered communication can facilitate behavior change in patients. Objectives. We will cover person-centered communication and its importance in healthcare, the key elements of person-centered communication skills in practice, how person-centered communication can facilitate behavior change in patients. Objectives. What is person-centered communication? Person-centered communication is an approach to communication that focuses on the patient as an individual, with unique experiences, values, and preferences. Person-centered communication is important in healthcare, highlighting benefits such as improved patient satisfaction, better health outcomes, and increased likelihood of behavior change. Person-centered communication can benefit patients, such as making them feel heard and valued, and it can improve healthcare outcomes by ensuring that patients are engaged in their care. Key elements of person-centered communication. The key elements of person-centered communication include empathy, respect, active listening, collaborative decision-making, and cultural competence. Each element to help us to understand how to apply these skills in practice. The person-centered communication is not a one-size-fits-all approach, and that healthcare professionals should tailor their communication style to the patient's needs and preferences. Empathy is the ability to understand and share the patient's feelings, thoughts, and experiences. Empathy is demonstrated using reflective statements to show understanding and acknowledging the patient's emotions. We all can practice empathy by putting ourselves in the patient's shoes and trying to understand their perspective. Respect. Respect is treating the patient with dignity and valuing their opinions and choices. Doctors and nurses can demonstrate respect by using open-ended questions to encourage patients to share their perspective and experiences. The importance of respecting patients' choices is immense, even if they differ from the healthcare professional's recommendations, and the need to avoid judgment or criticism. Active listening. Active listening is paying close attention to what the patient is saying and responding in a non-judgmental way. Examples include demonstration of active listening, such as using nonverbal communication to show engagement and interest. Active listening can improve communication and build trust with patients by ensuring that they feel heard and understood. Collaborative decision-making. Collaborative decision-making is working together with the patient to develop a plan of care that is aligned with their goals and values. Examples of shared decision-making techniques include exploring treatment options and discussing pros and cons. Collaborative decision-making is essential for ensuring that patients are engaged in their care and that their preferences and values are taken into account. Cultural competence. Cultural competence is recognizing and respecting the patient's cultural background and how this may impact their healthcare needs and preferences. Healthcare professionals can demonstrate cultural competence by asking patients about their cultural background and beliefs. The importance of understanding and respecting cultural differences is immense to ensure that patients receive culturally sensitive care that meets their needs. Applying person-centered communication in practice. Doctors and nurses may apply person-centered communication in practice, such as asking open-ended questions, using reflective statements, and active listening. Multiple case studies or scenarios have demonstrated how to apply person-centered communication in different situations. The audience should practice these skills in their own interactions with patients and seek feedback from colleagues and patients. Motivational interviewing. Motivational interviewing is a person-centered approach to behavior change that focuses on exploring the patient's ambivalence and motivation to change. Motivational interviewing techniques, such as open-ended questions and reflective listening, can help healthcare professionals support behavior change in patients. Motivational interviewing should be used in practice, and the need for ongoing training and practice to master this technique is needed. A patient-centered approach to setting achievable and meaningful goals helps patients focus on the behavior change they want to achieve. Examples: what is one thing you would like to achieve in the next week? Overcoming barriers to person-centered communication. Common barriers to person-centered communication, such as time constraints, language barriers, and bias. Strategies for overcoming these barriers include setting aside dedicated time for communication, using interpreters when necessary, and addressing personal biases through self-reflection and education. Audience should be mindful of these barriers and develop strategies to overcome them in their practice. Conclusion. Summarize the key points of the presentation, emphasizing the importance of person-centered communication in healthcare, the key elements of person-centered communication, and strategies for applying these skills in practice. Reinforce the idea that person-centered communication can facilitate behavior change in patients and improve healthcare outcomes. Encourage the audience to continue to develop their person-centered communication skills through ongoing education and training. You may refer to above for further reading. Let's start with MCQs. What is person-centered communication? A communication style focused on the healthcare professional's needs. B. A communication style focused on the patient's needs. C. A communication style focused on both the healthcare professional and patient's needs. Answer: B. Why is person-centered communication important in healthcare? A. It improves patient satisfaction. B. It improves patient outcomes. C. Both A and B. Answer: C. What are the key elements of person-centered communication? A. Empathy, active listening, and respect. B. Empathy, active listening, and efficiency. C. Empathy, active listening, and diagnosis. Answer: A. What is active listening? A. Listening carefully and attentively to the patient. B. Interrupting the patient to ask questions. C. Assuming what the patient is going to say. Answer: A. What is cultural competence? A. Understanding and respecting the beliefs, values, and customs of different cultures. B. Treating all patients the same regardless of their cultural background. C. Focusing on the healthcare professional's culture. Answer: A. How can healthcare professionals demonstrate cultural competence? A. By using language and terminology that is familiar to the patient. B. By being aware of their own biases and assumptions. C. Both A and B. Answer: C. What is motivational interviewing? A. A technique that focuses on exploring the patient's ambivalence and motivation to change. B. A technique that focuses on telling the patient what they should do. C. A technique that focuses on diagnosing the patient's problems. Answer: A. What are some common barriers to person-centered communication? A. Time constraints, language barriers, and bias. B. Technology, equipment, and workload. C. Lack of training, education, and experience. Answer: A. How can healthcare professionals overcome language barriers in communication? A. By using interpreters or translation services. B. By assuming the patient understands the language. C. By using medical terminology that is universal. Answer A. Why is ongoing education and training important for healthcare professionals? A. To improve their person-centered communication skills and cultural competence. B. To increase their workload. C. To decrease their stress levels. Answer A. What is reflective practice? A. A technique that involves reflecting on one's own communication skills and interactions with patients. B. A technique that involves reflecting on one's own biases and assumptions. C. A technique that involves reflecting on one's own diagnosis and treatment plan. Answer A. How can healthcare professionals tailor their communication approach to the patient's needs and preferences? A. By asking open-ended questions. B. By using reflective statements. C. Both A and B. Answer C. How can person-centered communication facilitate behavior change in patients? A. By building trust and rapport. B. By developing culturally sensitive care plans. C. Both A and B. Answer C. Thank you for time and attention. Contact information for further discussion or questions.